Well, I think the rationale for this meta-analysis by Lipinski and colleagues was that the BioFlow 5 trial that compared the Orsiro stent, a biodegradable polymer sirolimus eluting stent, with the Xion stent, a durable polymer everolimus eluting stent, showed a significant reduction in target lesion failure at 1 year in patients treated with the Orsiro as compared to the Xion stent. And of course, the data has to be interpreted in the entirety of the available evidence, and for this reason, the authors decided to perform a meta-analysis including all studies comparing patients treated with Orsiro as compared to any other contemporary drug-eluting stent. In the end, the meta-analysis showed no significant differences with regards to clinical endpoints at 1 or 2 years. However, there were some interesting trends. For example, there were trends towards a lower risk of myocardial infarction and a lower risk of definite or probable stent thrombosis in patients treated with the Orsiro stent as compared to patients treated with any other newer generation drug-eluting stent. However, there was also a trend towards an increased risk of all-cause mortality in patients treated with the Orsiro stent as compared to patients treated with other drug-eluting stents. However, there were no significant differences with regards to cardiovascular mortality. I think the Orsiro stent combines two interesting features. First, it has an ultra-thin stent platform made out of cobalt chromium, and previous studies suggested that strut thickness may be associated with clinical outcomes. I think that's the first issue. The second interesting feature is the biodegradable polymer, and previous studies suggested that permanent polymers may entertain a chronic inflammatory response, may have a hypersensitivity reaction that in turn increase the risk for late stent thrombosis or neoatherosclerosis, and therefore I think a biodegradable polymer may be the future. I think the results corroborate the safety and efficacy of the Orsiro stent as compared to other contemporary drug-eluting stents, and it may give further momentum to the study of stent platforms combining ultra-thin struts with biodegradable polymers.